years of uploading. So, okay.
So what were you just saying?
I said that if you have something outward that you can see, it's called what? Sign. Okay, a symptom is something they tell you about. Something you can see is a sign. What is a you ready? Trauma. Okay, Ben's ready with trauma. Whoever wants to go. Thank you. Appreciate it. Smile. Okay. Hope he's not your evaluator. Disadvantage of an OPA. You're going to want to know disadvantages and advantages of OPAs and NPAs. You want to know how to speak to elderly people with hearing impairments, how to communicate with them effectively. I can tell you it's not screaming at them and it's not speaking like right to their ear.
Isn't it getting...
They have to be able to see your lips.
Yeah.
You get nice and close.
When you withhold resuscitation measures in a cardiac arrest, there's only one situation, okay?
They have the DNR.
Yes. They have a DNR signed by themselves and a doctor, okay? So if they have religious beliefs that say, I don't want you to do CPR, do you not do CPR?
No?
You do it, okay? They have to have a DNR. If they have religious beliefs, they should have filled out a DNR. That's simple.
Bless you.
So if you're trained to a minimal level in medical emergencies, what would that level be called? And it's not EMT, okay? EMT is kind of the middle level. Paramedics up
First
here.
responder?
EMR.
Yeah, emergency medical responder. That's correct. You need to know where you can take a femoral pulse. What is the side effect to an EpiPen? A lot of scene safety questions to make sure you're going with whatever makes the scene safe. You need to know what an avulsion is, and the difference between an avulsion and an amputation. You need to know what anemia is. There's different types of anemia, so you should look at those. You need to know the difference between respiratory distress and respiratory failure. Remember, distress is something they're maintaining. Excuse me, failure they're no longer maintaining, they're starting to decompensate. When to use cold packs and how to use cold packs on a patient. Know that you should never apply a cold pack directly to the skin. There should be. You need to know how to take care of yourself as an EMT, what are good healthy habits and what are unhealthy habits. That's pretty basic, you guys should be fine. You need to know what happens to blood vessels during an anaphylactic reaction. You guys know what happens to blood vessels during an anaphylactic? What do they do? Yeah, good job, Zach. They dilate, right? You get real big. That's why you can't breathe, because everything's swollen. What type of assessment is it called when you focus in on one area? You need to know that. You know the difference between a focused exam and a physical exam or a rapid trauma exam, what those are. You need to know what the different levels of mental status are. Alert, verbal, painful, unresponsive. What qualifies as those? Do you ever encourage a psychiatric patient if they're saying, I see stars? Do you tell them, yeah, those stars are there? No, right? We don't encourage delusions ever. If you rode on the ambulance and seen that, that is not a good thing. And I'll be honest, it happens. I work in this field. I know sometimes it's easier for medics and EMTs to go, yeah, man, it's all right. I see him too. Okay, you should never do that. Okay, don't ever encourage delusions. You can say it's been hard for you. I understand you're going through a lot. You can be supportive, but don't say, yeah, I see that shit too. Our personal safety is always our first concern. It's us, then our partner, then everybody else. Got to know what tachycardia is, what bradycardia is. Need to know the difference between referred pain and visceral pain and somatic pain. Do we ever remove an object from a patient that's struck into them? No. The only, what did you say?
Unless it's in their cheek.
Yes, that was exactly what I was going to say. Unless it's in their cheek, we don't remove anything. Okay? So, i.e., I got something sticking out of my head, we don't remove it. Okay? Not a good idea. What situation, you need to know when an EMT can assist with a prescribed inhaler and what you have to do to make that happen. You need to know what the danger is with a tourniquet and a fistula. You need to know how long an epi auto-injector takes to start working. You need to know both the terms anatomy and physiology and what they mean. You need to know what snoring respirations sound like. And just knowing that your partner snores does not work. So if we're classifying shock, we classify it in one of two ways. Remember, there's different types of shock. That's one thing. If we're classifying the severity of shock, it is either one or two. What are those? Compensated or decompensated. Those are our classifications of the severity of shock. Compensated or decompensated. So terms like uncompensated or non-compensated are not real things, right? Or consumption, probably not the right answer. Remember, a lot of these questions are which of the following are not correct, or which of the following are not the right answer. Don't let that trip you up. Slow down, read those thoroughly. Understand that one of those is not what they're looking for and the rest are okay. So if you had a juvenile patient that was critical trauma patient, there are some things that you could wait and do on scene, that you have to do on scene to manage that patient's airway, breathing, circulation, maybe their C-spine. There are some things that we wouldn't wait and do on scene. We would get moving towards the hospital with or without those things being done. You need to know how long to suction for. You need to know why kids are more likely to be hypothermic. Right? Lots of body surface area, not a lot of body fat. Some of these are directly out of the other test, by the way. So if you remember anything from our other test, some of these are directly out of there. Such as a neck laceration, what we're worried about with a neck laceration, a lot of you guys got that question wrong, would be an air embolus, because it could suck in air through the vein. Those different types of pain, really got to know those. You need to know what your order of assessment is. So if you're assessing an unresponsive patient, you do your rapid physical exam. What are you doing next? You need to know what hypoxia means, which I'm sure you all do. You need to know what hypercarbia means and hypocarbia. You need to know what the term is for carbon dioxide and oxygen moving across the cell membrane. What's the name of that? Oxygen and carbon dioxide moving across the cell membrane. You need to know what the abdominal quadrants are called. Pretty easy, but you need to know it. You need to know what topography means relating to anatomy. So not like a map, but do we use humidified oxygen on the ambulance?
No.
Why do we think that we don't use it? And they do use it in nursing homes and long-term care settings.
Isn't it?
Yeah, so short ambulance transport's probably not going to make a difference. So if there's something about like adding bleach to that water is probably not the right answer. You need to know about the difference between delayed stress reactions, cumulative stress reactions, and post-traumatic stress disorder. And how those are classified. So they'll give you an example and tell you a story, and you're going to have to classify whether it's a delayed stress reaction, post-traumatic stress, or something else. This is a good one. If you notice that an anterior fontanelle is bulging, and a child had just fallen over prior to this but is crying profusely, what do you think would cause that fontanelle to bulge a little bit?
What is it?
Swelling.
Well, they said when they're upset it'll bulge.
Right. So when the
So-
patient gets really upset, if they're crying a whole bunch, that can cause that anterior fontanelle to bulge. It's a tough question.
So we can just wait until they settle down and see if it's still bulging?
Probably a good idea. Try to calm down.
What are the two Alex?
One or two what?
Isn't his name Alex? No. In your office, where is it?
Andrew?
Yeah.
Joint immobilization and long bone immobilization. So, if you notice fluid leaking from a truck, and there's a little triangle on the truck, what would you look at?
Your ERG?
Your ERG, good. Where are you at?
Medical first door on the left.
Okay, somebody can go to medical, first door on the left. That's a dumb question. You need to know what the twilight years commonly stand for? What period of life? It's late adulthood. That's a dumb question. That's a dumb question. Late adulthood.
Trauma's open.
Trauma's open. There you go. You need to know what bonding means between infants and parents. What that's called. What the requirement is for bonding to be met between infants and parents. You need to know how to calculate a correct APGAR score given a scenario. Would a broken femur be more important or a penetrating chest trauma?
Penetrating chest traumas.
Penetrating chest trauma. An isolated long bone injury, although could be dangerous because it takes a lot of force to break a long bone, is not as dangerous as a penetrating chest trauma because what can happen? What's the next thing when that happens? Lung collapse, and you can die from that in a matter of seconds. So we talked about that with one of the other tests, but people got it wrong. So you need to know methods of decontamination from a hazardous material incident. You need to know about the pediatric assessment triangle. You need to know who is most successful in suicide attempts.
Elderly men.
What did you say?
Elderly men.
You need to know where a choking generally occurs. Where does a choking generally occur? What part of the airway? Upper airway. Correct.
Sound like a pig.
Who says clear when operating an AED?
The person operating.
Yep. You need to know what positional asphyxia is. So you both went on both skills? Alright, 2 more to my office.
It says clear on, he taught that. Didn't do nothing wrong.
If I had a chair, I'd remake that. Oh my god. It was a good shuffle there. Good shuffle. You need to know what conduction means. How you lose or gain heat by conduction. Make it happen. You know what an abdominal evisceration is? And how you treat it. You need to know how shock presents in a small child. Okay? So they may not have wet diapers, they may not have tears, but they're still crying. There's a lot of different things they can present with. You know what a hernia is and how you would feel that or assess that? You need to know what would happen to a patient who misses dialysis. What kind of electrolytes would be high? Is hyperextending the head in a pediatric a good thing? No. Do we ever do blind finger sweeps? Okay. Why do infants not have allergic reactions? Anaphylactic reactions?
The immune system's not built up.
Yes, they haven't built up antibodies yet. Good. If somebody gives you a location in layman's terms, you need to understand how to say it in the correct term. So, whether it's the superior, the posterior, inferior, if I say that the front of my leg has an injury, the front of my thigh, you need to be able to say where that's at. That's going to give you different examples, and you have to pick the correct one. So, say superior to the knee or inferior, or blah, blah, blah. Oh gosh. You need to know what level a first responder who has awareness, hazmat awareness, hazmat operations, or first responder operations, hazmat technician. You need to know what the difference are. So somebody that helps prevent something from spreading would be operations. They're probably doing some damming or diking. If they're awareness, they see a hazard and they say, I'm going to stay back. That's pretty much awareness. Technicians are going to go in and plug holes and play with the goo. Specialists are people that know, hey, how you doing? You want to do some cardiac arrest right in this room? They're going to bring you their sheet. Now let's assume you don't get a call in the next 30 seconds. If you get a call, you sleep. Okay. They're going to bring you their sheet with their name on it. You're going to mark whether or not they pass, fail, what critical failures they make, if they make any. So you're going to just grade them like a National Registry evaluator and hand it back to them. If they fail, it's fine. Just mark that they failed, hand it back to them, and we'll get them another day. If they pass, that's great too. And obviously now they can't come through your station. So, okay, somebody can go to Josh. Really, anybody. Cardiac arrest, Josh, right here. If you've already done one, which I think you have, it's fine. We'll try to get everybody through one. We'll try to get everybody through one, but it's all right. Tommy, my man, how are you? Would you like to do? Yeah, you're good. I know. Fine. What happened was we had a cancel class on Monday, so I had to move them all up today. They finished their test super fast, which I was surprised at. I know. 50 questions to 100. I should have realized that was going to happen. Anyway, they moved through it quick, so we're just doing skills, and I'm doing a review and recording it for them at the same time. You're fine. Can you do spinal mobilization in the bay? That would be super swell. Thank you. Appreciate you.
Step down there.
I think so. It's in the bay. They have their packets. They're going to bring you their packet. Their names are on it. You just mark off whether they pass or what, you do it's testing right. So if they fail, just hand it back to them and say they failed on there, and they'll have to retake it.
Go.
Okay. So somebody can go with Tommy in the bay. Bring your packets. Hey, you've already gone some. Let camera go.
Okay.
Just go a long way.
Cameron's done a lot.
There's a station.
That's so much. I'm teasing.
I didn't know you'd done any.
Station in there.
Oh well.
The
Sorry.
overachiever.
No, I think I already told you this, but you have to contact medical control to give albuterol, so do that. You need to know how to prioritize patients, right? So if they're red, what does that mean?
Priority one.
Right? Very severe. They're, have a danger of losing their life, right? Yellow is they may not be walking around, but they have injuries, but they're alert, probably. Black tag would mean they're dead, right? Not breathing, no pulse. Green tag, they're up walking around, but they have some injuries.
I do have a question about that. The 30 respirations, if it's greater, it's red, right?
I think so.
Yes.
Yes. Okay.
Because
That's
the
not
test,
how we judge in our
the
real
test
world.
was a little confusing
Okay.
for those questions.
Yeah, there was a lot of them. I tried to warn you guys about that. Do we ever try to put a protruding bone back under the skin?
No.
No. What? When you know what kind of injuries a blast could cause? Need to know what enhanced 911 is? Should know that. There's a lot of these. Like, which of the following is not correct? I hope you guys watch the knots carefully. Hey Tommy, what's up? Hello?
Hey, do you want to send me one or two more so we have a patient?
Oh yeah.